the esophagus, right? That empties into this water-shaped organ here, the stomach. The stomach empties into the small bowel here. That's where the pancreas is, okay? And the liver is sort of the big elephant in the room. Sort of the biggest organ in the body, right? Liver makes bile, the bile comes down the bile ducts, goes through the pancreas, goes into the bowel. Now, if you look at this picture and you look at this picture, you can see that the colon is related to the liver because all of the blood that goes to the colon ultimately, with all the nutrients that you eat and drink, ultimately goes back to the liver where that stuff gets processed, right? The liver, breaks down drugs, anything to think about. The liver is an important part of that function, right? So when you have a tumor here, which is where your tumor is, sort of in the rectus sigmoid region here, right? This is your bottom, right?
Mm-hmm.
Those tumors can spread along these veins back to the liver. So that's how you get a liver lesion. Okay? So essentially you're getting the chemo radiation now. The chemo is also affecting that liver mass, right? The liver mass is in segment 6. So segment 6 is in the liver on the back side of the right side of the liver. Okay? So the right side of the liver goes all around here, including back here, right? So that's where your mass is. Sort of a little bit closer towards the back. So essentially the surgery, those type of things can be taken out laparoscopically, but with all the surgery you need done, it's probably better to do it open. Okay? So you have a long midline, and then Dr. McNally will probably take this colon out, put it back together. She may elect to put a diverting loop ileostomy to protect the synostomosis. And often then she may go back and then take down her ileostomy locally, sort of through a small incision, like 6-8 weeks later. Okay? But I'm not sure exactly what she wants to do. You could take this out and put it back together primarily, because it's not that low. When it's a lot lower down, you tend to have to do that.
Okay.
But I'm not so sure she's going to do loop ileostomy. Okay? So, the liver part, essentially what we have to do, the liver is connected to the abdominal side wall here and here, where these ligaments. So essentially what we have to do is divide this ligament, the heart's right here, divide this ligament and we rotate the liver. So that even though this thing is way back here, we rotate it such that this thing then comes to the center of the field.
Wow.
Okay? And that won't hurt you. We do it all the time. Okay? And then we will essentially imagine taking a slice out of a pizza pie. Right? So in liver surgery we can do segmental resections where we take out half the liver, and you don't need that. You just need a slice of the pizza pie.
Nice.
You have to essentially take the liver mass out with some surrounding normal liver tissue, getting what we call a negative margin.
Okay.
Generally, we aim for about 1 centimeter, and that's how we get a negative margin. We give it to the pathologist, make sure they're comfortable with that margin, and then we're done.
Okay.
Bleeding from that kind of thing is relatively small. You shouldn't need a transfusion. Sometimes there are veins that can bleed. We'll just control the bleeding. We'll take a look at the rest of the liver as well, because sometimes you may have small lesions that are less than 1 centimeter that you can't see in some of the scans. If you find those, we'll take those out too.
So I know all surgeries are kind of difficult. That doesn't seem like a very difficult.
As it pertains to liver surgery, it's not, no. I mean, you can take out the right half of the liver, the left half, 2/3 of the liver. You just need from what I see right now, a relatively small liver resection.
And does the liver
Yes, it does regenerate.
Okay.
So typically, some patients, depending on whatever disease process they have, we can take out as many as 6 contiguous segments, which is about 70-80% of the liver.
Holy cow.
They will go back.
That's crazy.
We don't do that very often.
Right.
And often we cheat before we do that. So we will block one of the veins going to the side of the liver that we're going to take out. That side will get smaller, the other side will get bigger before surgery. So when we take it out, it's safer.
So
But you don't need anything like that.
So about how long does surgery normally
So
on an average?
it's probably going to take at least 4 to 5 hours for us to get all of the work done, I think.
Okay.
Obviously, you'd be asleep. As I said, from the liver part, I think that's relatively straightforward. Even the rectal part, Dr. Minaj is very good. So I would anticipate she'll be able to do that without too much blood loss or anything like that. So.
Okay.
Okay.